Hello, welcome back. The topic today is chemotherapy. What is chemotherapy? Chemotherapy, most of the people would have heard about chemotherapy, radiotherapy, especially in the cancer treatment. So, chemo means chemical, therapy means treatment. The chemical treatment given for cancers. What are cancers? In the previous videos, we have talked about cancers. What is cancer? Cancers are rapidly growing normal cells beyond their control independently. They become independent growth because of some mutations. So they become normal cells, become abnormal, and independently, without control, they are growing. So to kill these fast growing, rapidly growing, multiplying independent cells, we are giving chemotherapy. So generally, if it's a cancer, if it's operable or any visible cancers, surgery is one first line. Second line is chemotherapy and radiotherapy. So chemotherapy given as a primary treatment. Like suppose they have a blood cancer, so that is a primary treatment. Even it can be given to prevent recurrence of the cancer. Suppose somebody has undergone breast cancer, so to prevent it coming back, we can give chemotherapy. Or sometimes it's given as a palliative. Palliative means we can't cure the disease because of some reasons, because it's stage 4 or the patient is not that fit enough for any treatment. Then it can be given for palliative treatment. So symptomatic relief can be given for the patient. So this is chemotherapy. So chemotherapy is decided, or the treatment is decided by the medical oncologist. They are the cancer physician. They decide according to the cancer, cell of origin, the grade and stage of the disease, and patient's general condition, patient's other comorbid, like if they have a kidney disease or they have a heart disease. These all taken into consideration. And not only that, it has first line treatment, second line, third line. Suppose usually the first line is the best treatment. For some people may not respond to that medicine, or that medicine may not be suitable because of their kidney problem, because of the heart problem. The first line treatment may not be given. So the second line, or even sometimes third line treatment can be given. And usually it is given as as a tablet or in the injection form. Whatever it goes to the body and it travels in the blood, and it goes to the cancer cells. Autonomously multiplying cancer cells are destroyed by the chemotherapy. So generally the cancer cells spread by encroaching the nearby structures or through the blood or the lymphatic system. So the chemotherapy, when it's given through the blood, majorly it prevents the cancer spread to the distant organs through the blood. So the blood spread is prevented or stopped. This is number one. Sometimes there are certain types of chemotherapy like adjuvant chemotherapy, neoadjuvant chemotherapy. They're all nothing but, suppose the cancer tumor or the the tumor is very big, or it is situated in a tricky place. So the neoadjuvant chemotherapy, before the surgery, the treatment is given. So it goes to the blood and controls or reduces the size, the bleeding. Everything is controlled by the chemotherapy, followed by surgery, and then followed by the remaining dose of the chemotherapy. It's all total dose. How usually it's given a cycle, 6 cycles, usually 21 days interval. But there are so many combinations and differences. It's all decided by the medical oncologist. And some people may require radiotherapy. Radiotherapy is a kind of radiation that prevents the encroaching blood cells, cancer cells. The other type of chemotherapy is called targeted chemotherapy or targeted drug therapy. What is that? It's certain cells has some peculiar characters, like peculiar proteins or peculiar mutations, peculiar enzymes. To target that enzymes or proteins in the cancer cell, that's called targeted chemotherapy. So like monoclonal antibodies, they're all they target only the cancer particular cells. So chemotherapy is a life-saving therapy. It's like antibiotics. So we are giving antibiotic to kill the bacteria. The same way, it's a medicine given to kill the cancer cells. It has its own side effects. Like any other medicine, it has side effects like they may feel nausea, vomiting, weight loss, hair loss. These are all commonly people know. And they not only that, they can even suppress the bone marrow, the red cell production, or any cell production, white cell production. Everything is suppressed. So the chemotherapy can suppress your immunity by suppressing the bone marrow. So they can get anemic, their immunity can go down. But they're all mostly temporary. Then they all can reverse back after the treatment. So chemotherapy is one form of cancer treatment. It's a part of treatment, adjunct to the surgery or independent to the treatment as a treatment, or even with radiotherapy. Thank you.